Hello, and thank you for joining Soul Sessions Through the Eyes of Us. Soul Sessions Through the Eyes of Us is a safe space for the panel to discuss various local and global events and provide information on current topics that affect African Americans. Disclaimer: the opinions voiced on this program do not necessarily reflect the views or opinions of the AAFCC, its staff, volunteers, board of directors, or underwriters. I'm Marlo Hatchett, one of the peer mentors at the center.
And I'm Anastasia, the program manager.
So today we're going to be talking about the monkeypox outbreak that has been going on this past month.
I'm sure as of late you've heard about monkeypox, as it has spread across the globe in a matter of months. Monkeypox is a rare disease caused by infection with the monkeypox virus. The monkeypox virus is part of the same family of viruses as the variola virus, the virus that causes smallpox. Monkeypox symptoms are similar to smallpox symptoms, but milder, and monkeypox is rarely fatal. Monkeypox is not related to chickenpox.
Monkeypox was discovered in 1958 when 2 outbreaks of pox-like disease occurred in colonies of monkeys kept for research. Despite being named monkeypox, the source of the disease remains unknown. However, African rodents and non-human primates, like monkeys, might harbor the virus and infect people.
The first human case of monkeypox was recorded in 1970. Prior to the 2022 outbreak, monkeypox had been reported in people in several Central and Western African countries. Previously, almost all monkeypox cases in people outside of Africa were linked to international travel to countries where the disease commonly occurs or through imported animals. These cases occurred on multiple continents, and monkeypox spreads in various ways.
Monkeypox can spread to anyone through close, personal, often skin-to-skin contact, including direct contact with monkeypox rash, scabs, or body fluids from a person with monkeypox, touching objects, fabrics, clothing, bedding, or towels, and surfaces that have been used by someone with monkeypox, contact with respiratory secretions.
This direct contact can happen during intimate contact, including oral, anal, and vaginal sex, or touching of the genitals, hugging, massaging, and kissing, prolonged face-to-face contact, touching fabrics and objects during sex that were used by a person with monkeypox and that have not been disinfected, such as bedding, towels, and toys.
A pregnant person can spread the virus to their fetus through the placenta. It's also possible for people to get monkeypox from infected animals, either by being scratched or bitten by the animal, or by preparing or eating meat, or using products from an infected animal. A person with monkeypox can spread it to others from the time symptoms start until the rash has fully healed, and a fresh layer of skin has formed. The illness typically lasts about 2 to 4 weeks.
Scientists are still researching if the virus can be spread when someone has no symptoms, how often monkeypox is spread through respiratory secretions, or when a person with monkeypox symptoms might be more likely to spread the virus through respiratory secretions, and whether or not monkeypox can be spread through semen, vaginal fluids, urine, and feces.
Symptoms of monkeypox can include fever, headache, muscle aches, and backache, swollen lymph nodes, chills, exhaustion, respiratory symptoms such as sore throat, nasal congestion, or cough.
A rash that may be located on or near the genitals, but could also be on other areas like the hands, feet, chest, face, or mouth. The rash will go through several stages, including scabs before healing, and the rash can look like pimples or blisters and may be painful or itchy.
You may experience all or only a few symptoms. Sometimes people get a rash first, followed by other symptoms. Others only experience the rash. Most people with monkeypox will get a rash. Some people have developed a rash before or without other symptoms.
Monkeypox can be spread from the time symptoms start until the rash is healed, all scabs have fallen off, and a fresh layer of skin has formed. The illness typically lasts 2 to 4 weeks.
If you have a new or unexplained rash or other symptoms, avoid close contact, including sex or being intimate with anyone, until you have been checked out by a healthcare provider. If you don't have a healthcare provider or health insurance, visit a public health clinic near you. When you see a health provider, wear a mask and remind them that this virus is circulating in the area.
Take the following steps to prevent getting monkeypox. Avoid close skin-to-skin contact with people who have the rash that looks like monkeypox. Do not touch the rash or scabs of a person with monkeypox. And do not kiss, hug, cuddle, or have sex with someone who has monkeypox.
Avoid contact with objects and materials that a person with monkeypox has used. Do not share eating utensils or cups with a person with monkeypox. Do not handle or touch the bedding, towels, or clothing of a person with monkeypox.
Wash your hands often with soap and water or use an alcohol-based hand sanitizer, especially before eating or touching your face and after you use the bathroom. In Central and West Africa, avoid contact with animals that can spread monkeypox virus, usually rodents and primates. Also avoid sick or dead animals as well as bedding or other materials they may have touched.
There are no treatments specifically for monkeypox virus infections. However, monkeypox and smallpox viruses are genetically similar, which means that antiviral drugs and vaccines developed to protect against smallpox may be used to prevent and treat monkeypox virus infections.
Antivirals such as tecovirimat, TPOXX, may be recommended for people who are more likely to get severely ill, like patients with weakened immune systems. If you have symptoms of monkeypox, you should talk to your healthcare provider, even if you don't think you've had contact with someone who has monkeypox.
The Biden administration on Thursday declared monkeypox as a public health emergency, with cases on the rise across the U.S. The announcement came during a briefing with the Department of Health and Human Services. The administration has been criticized at times for its handling of the outbreak, and some have called on the government to declare a national emergency without delay.
Since the first U.S. monkeypox case was identified in mid-May, more than 6,600 probable or confirmed cases have been detected in the United States. Cases have been identified in every state except Montana and Wyoming. On Tuesday, President Joe Biden named Robert Fenton as the White House's National Monkeypox Response Coordinator. Fenton, a regional federal emergency management agency administrator who oversees Arizona, California, Hawaii, and Nevada, will coordinate the federal government's response to the outbreak.
Dr. Dimitri Daskalakis, the U.S. Centers for Disease Control and Prevention's director of the Division of HIV/AIDS Prevention, serves as the deputy coordinator. The Biden administration has been heavily criticized by some public health experts for not moving faster to address this crisis. One of the criticisms of the administration's response, as CNN reported earlier Thursday, was that HHS has waited more than 3 weeks after the first confirmed case of monkeypox in the U.S. to order bulk stocks of the monkeypox vaccine, which the government owns and stores in Denmark, be bottled and sent to the U.S. for distribution. The delay was in part out of concern that once those vaccines were taken out of bulk storage, they would lose years of shelf life.
Monkeypox can affect anyone, but the majority of cases in the United States outbreak have been among men who have sex with men, including gay and bisexual men and people who identify as transgender. Close contact with an infected individual is required for the spread of the monkeypox virus, experts say. The CDC initially announced vaccines for monkeypox were being released from the Strategic National Stockpile and offered to high-risk contacts of monkeypox patients, as well as the health care workers treating them. Federal health officials have since expanded vaccination efforts to focus on the broader community of men who have sex with men, the demographic that makes up most of U.S. monkeypox cases.
In addition to providing vaccines, the CDC has said since June it has made a concerted effort to do extensive education and outreach to the LGBTQ community. Health officials are considering changing the way monkeypox vaccine doses are administered because the country is at a critical inflection point with the virus's spread. U.S. Food and Drug Administration Commissioner Dr. Robert Califf told reporters on Thursday.
In recent days, it's become clear to all of us that given the continued spread of the virus, we're at a critical inflection point, dictating the need for additional solutions to address the rise in infection rates, Califf said. The goal has always been to vaccinate as many people as possible. The commissioner said officials are considering allowing healthcare providers to be able to use a dose-sharing method where one vial of the vaccine previously used as one dose will be used to administer up to 5 separate doses.
This approach would change the way that the vaccine is administered, Califf said. Instead of the vaccine being administered in the fat layer under the skin, it will be delivered underneath the skin layer. There are some advantages to intradermal administration, including an improved immune response to the vaccine, Califf said. It's important to note that the overall safety and efficacy profile will not be sacrificed for this approach. Please know we've been exploring all scientifically feasible options, and we believe this could be a promising approach. And that is the end of the topic today. We hope you learned some good information about monkeypox. Now we're going to be going into our lead section of the program. Alright, so now we're going to go into the lead portion of the show with Mr. Dalen Whitaker.
Hello everybody, my name is Dalen Whitaker. I'm the project coordinator here at the African American Family and Cultural Center. LEAD stands for Leadership, Equity, Action, and Development. The goal of the LEAD program is to promote and to protect a tobacco-free lifestyle for all Butte and Yuba County residents. Our objectives are resisting targeted price promotions. The tobacco industry spends billions of dollars annually on targeted advertising. Low-priced products and coupons contribute to high smoking rates among people of color and in low-income communities, and make it easier for youth to become addicted. Objective 2, developing upstream approaches to tobacco control. By including tobacco control in general plans and other municipal codes, we protect communities from exposure to tobacco products and help to prevent poor health later in life. We believe limiting exposure to tobacco is an environmental justice issue. And then the third objective, growing community advocates. We support and empower youth and young adults to fight back against the tobacco industry's targeting of marginalized people, all right? And today we're going to be talking about the unfair and unjust practices and conditions that harm African American people and drive health disparities, okay? So, I'm going to start, and then, I'm going to have Miss Marlo read after me, and we're going to do a little popcorn in here, all right? So let's get right into it. Some U.S. historical policies and practices have led to mental and physical health risks and challenges and related long-term health outcomes for African American people. For example, for centuries, African American people have been harmed by unjust practices related to the sale of commercial tobacco. For instance, enslaved people were forced to grow and harvest tobacco that would later be sold.
Tobacco companies have a long history of trying to influence African American people by donating to historically black colleges and universities, and also sponsoring scholarships for African American students. They give money to influential African American people, officials, and organizations. Tobacco companies have also advertised more heavily in magazines with larger numbers of African American readers. African American people also experience discrimination and harm from systems meant to protect and improve health and well-being, including healthcare and medical science. Research shows that some African American people may hesitate to seek care because they don't trust the government or healthcare systems that have treated African American people unfairly in the past.
As recent as the 20th century, doctors and researchers have done studies and medical procedures on African American people without their permission or knowledge. During the Tuskegee study of untreated syphilis in African American men, researchers allowed black men with syphilis to go untreated in order to compare their symptoms to black men without syphilis, who were also a part of the study. Other times, African American women were sterilized, made unable to have children, without agreeing to it first. These actions led to the mistrust of the healthcare and medical research and help explain some of the causes of health disparities. Other reasons, like the ones explored below, help explain why the health of African American people is affected by commercial tobacco.
The tobacco industry targets African American communities with marketing and advertising. Marketing plays a big role in whether people try or use commercial tobacco products. Being around commercial tobacco ads makes smoking appear more appealing and increases the chance that someone will try smoking for the first time or start using commercial tobacco products on a regular basis. Neighborhoods and areas with more African American residents tend to have more stores that sell tobacco. Tobacco companies advertise more heavily in stores whose customers are mostly African American people. Tobacco companies use price promotions, such as discounts and multi-pack coupons, which are often most used by African American people and other minority groups, like women and young people, to increase sales. Tobacco companies support cultural events designed to draw in certain groups in the Black community. One recent campaign targeted at Black young adults involved pop-up concerts featuring hip-hop artists in convenience stores.
To help protect African American people from commercial tobacco marketing and discourage tobacco use, states and communities could consider limiting advertising, prohibiting sale price discounts, and allowing fewer stores in the neighborhood to sell commercial tobacco products. Tobacco companies promote flavored products, especially menthol, in neighborhoods where African American people live. Menthol has a minty flavor that can mask the harsh taste of tobacco. Menthol makes cigarette smoke feel easier to inhale and can make it harder to quit smoking. To attract African American people as customers, tobacco companies target African American communities with advertising and sales of flavored cigarettes, especially those with menthol. Tobacco companies have aggressively marketed menthol cigarettes to African American people since at least the 1950s and continue to do so today. In the 1970s and 1980s, the tobacco companies' menthol push included ad campaigns with messages tailored to Black people and images featuring Black models or hip-hop icons.
In 2019, about 85% of non-Hispanic Black adults who smoke cigarettes used menthol cigarettes. In 2019, about 58% African American youth aged 12 to 17 who reported smoking cigarettes used menthol cigarettes. Menthol products are given more shelf space in stores that have large number of Black customers. Stores located near schools with more Black students have been more likely to promote menthol cigarettes through advertising and discounts. The more Black children who live in a neighborhood, the more likely it is that menthol-specific marketing will be advertised near candy displays in stores. Wow. Stores in neighborhoods with more Black residents or residents with lower incomes advertise flavored little cigars and cigarillos more often and may also have more of them available to buy. There are actions that states and communities could take to make flavored commercial tobacco products less available, which might help more African American people quit smoking and might keep some African American people from starting to smoke.
In 2009, the Family Smoking Prevention and Tobacco Control Act gave the Food and Drug Administration the authority to ban sales of all characterizing flavors in cigarettes, except menthol. Cities, towns, and communities have limited the sale of flavored products and have seen the odds of residents, including young people, using any type of tobacco products or trying flavored tobacco products go down. A 2011 study that modeled what could happen if the U.S. banned sales of menthol cigarettes nationwide estimated that by the year 2050, such a policy could save more than 600,000 lives, including nearly 250,000 Black lives.
Stress can increase commercial tobacco use and make health problems worse. Stress, such as that caused by financial problems, discrimination, or violence, can make people in general more likely to smoke. Racism and discrimination are constant sources of stress for many African American people. In 2019, the majority of African American people said that they had been personally discriminated against because of their race. The pressure of discrimination has been associated with tobacco product use behavior, that a person will begin to use tobacco, and can also make it harder to quit. Healthcare itself can be a source of discrimination. 1 in 3 Black adults say they have personally experienced racial discrimination when going to the doctor, and many report avoiding seeking medical care because of it.
When people experience severe long-term forms of stress, their bodies respond by raising stress hormones and keeping them raised. When it goes on for a long time, they may develop health problems like high blood pressure and diabetes. Smoking cigarettes also leads to disease and disability and harms nearly every organ in the body. And this has been our LEAD portion for the day. Again, LEAD stands for Leadership, Equity, Action, and Development. And if you would like to learn more information about LEAD or our impact on the community of Black student unions, please feel free to contact me at dwhitaker@aafcc-oroville.org or 530-532-1205. We'll see you.
We would like to remind you that the opinions voiced on this program do not necessarily reflect the views or opinions of the AFCC, its staff, volunteers, board of directors, or underwriters.
So we have a community garden workshop coming up. The AFCC Community Garden is offering a free Gardening 101 workshop from seed to harvest to the community. This event will be Saturday, August 13th from 8 a.m. to 12 p.m. at the garden, located at 2733 Wyandotte Avenue in South Oroville. There will be items such as zucchini, tomatoes, peppers, and more. For more information, you can call the center at 530-532-1205. And we have our weekly programs.
Soul Sessions Through the Eyes of Us is every Tuesday from 5 to 6 p.m. A behavioral health counselor is at the center every third Tuesday of every month from 1 to 5, offering drop-in services and referrals. Personal Peace Institute is a free program via Zoom that provides participants with the skills and strategies necessary for recognizing and controlling angry feelings. The meetings are every Wednesday. The youth group is from 5 to 6, and the adult group is from 6 to 7.
Dance Diverse is our hip-hop and step dance class that allows participants to build relationships, learn leadership skills, and boost confidence. Everyone aged 7 and up is welcome to join. There is a beginner and advanced group. This class is every Friday from 2:30 to 5 p.m. Make sure you are tuned in to our community radio station, KOY 107.1 FM. You can also stream online at koyo.fm. Check out our live radio show, History Right Now, sponsored by the LEAD Project, every Wednesday at 10 a.m. with Dalen Whitaker, the project coordinator.
Please give us a call at 530-532-1205 if you are interested in signing up to participate, volunteer, or facilitate any of the events or programs. Next week's topic is going to be tips on how to be more organized and how to implement healthy routines in your daily life.
Check that one out. Thank you for joining us.
And stay safe, avoid close contact, wash your hands frequently, and disinfect them surfaces. Avoid getting monkeypox.
It may be smart not to go to big events, and if you do, wear a mask and try not to,
touch everything.
Get super close to people,
All right.
You got this. Stay safe.
See you next Tuesday.
Bye.
Bye.